Well, COVID-19 is here to stay, unfortunately, and we are learning more about a possible link between the virus and heart disease. Here to talk a lot more about this is our 9 Health expert, Dr. Payal Kohli. Dr. Kohli, thank you so much for coming in.
My pleasure.
I think a lot of people are going to be surprised to learn about this link that we're talking about. What do you think? Well, first of all, before I get into my questions, tell us about the study that's been done here.
Yeah, you know, it's kind of surprising to us as cardiologists because what we saw was a 30% increase in heart attacks occurring in an age group where we wouldn't normally expect to see that. The 25 to 44-year-old age group, not a demographic that commonly has heart attacks. And really what's more concerning about this finding is that we saw it even during the Omicron surge, suggesting that even a milder variant like Omicron could cause this. And this has really turned the trend for heart disease kind of on its head. We were doing so well before the pandemic with reducing heart disease, heart attacks, and morbidity and mortality, and this has sort of reversed that.
Yeah, that kind of is a little bit scary to learn about this. What were the results of this study?
So the study showed that increase in heart attacks. Now, why that happened, we're still scratching our heads a little bit. We're wondering, is it a direct cause?
Yeah.
Meaning, does the virus itself infect the blood vessels and the heart muscle, causing inflammation, causing increased risk of clotting? Or is it more indirect, that this demographic got affected more from a psychosocial standpoint, had more stress, had more substance use, maybe had less access to doctors? Or is it likely a function of both of those?
Now, is this different from myocarditis?
Very different.
Okay.
And so myocarditis is actual infection of the heart muscle itself. This is actually blood clots occurring in the blood vessels that supply blood to the heart, causing a heart attack or damage to the heart muscle. So it's really a disease that happens kind of to older people, and now we're seeing it in this younger demographic. So somehow COVID has sort of accelerated the process of aging of our blood vessels. Now, why we're seeing a bigger increase in the younger people, is it because their baseline risk was so low, and so that delta is a little bit higher? Or is it because their immune systems are more robust, so they actually launch a much more aggressive immune response, which can then inadvertently affect the blood vessels?
Well, you know me, I nitpick every little number that my doctor gives me because then I come and report it back to you and tell you what he said. I'm curious, you know, for the young people that might be worried about this, or for anybody who might be worried about this link, is this something they can ask their doctor when they go to their appointments?
Yes, and in fact, the American Heart Association has now said that having had COVID at any point for anyone, regardless of their age, is now considered a heart disease risk factor.
Really?
Yeah, so we're routinely asking our patients about it. If your doctor doesn't ask you, you should mention it, because it's possible if you had COVID, particularly if your index illness or that when you were sick was pretty severe, you may actually want to screen earlier, screen more aggressively. It may affect the targets for where we get your blood pressure, your cholesterol, your sugar, etc.
Is there a pattern for how long it takes to see what that link is, or is this something you could trace it all the way back to the beginning of the pandemic?
You know, I think we're still learning that piece of it, but we know that the first year after COVID is the highest risk in terms of all kinds of biological complications. But what we think, and unfortunately what we think we're going to see, is that for many years later, it's going to continue to confer risk. So even after 20 years, it may have kind of left our blood vessels in a position where they're more likely to make inflammation and atherosclerosis.
Well, I know a lot of people's ears perked up hearing this. So as we always end every segment with Dr. Kohli, make sure you check with your doctor if this is something you're concerned about. Dr. Kohli, thank you for bringing this to us. Appreciate it. Let's check your forecast now with Ed.
All right.